First of all, I'd like to say thank you for inviting me here today. I'm not sure who invited me. Maybe it was Natalie, maybe it was Kylie, who knows, but it's a pleasure to be here. My name is Jamie McCarthy. I've been working for the transition team since about 2015. So that was shortly after the establishment of the NF clinic at the Royal Children's Hospital. And I'm going to talk about specific things that are related to the Children's Hospital. So how a young person with NF will move from RCH to Kate Drummond's team at the Royal Melbourne. So for those of you that are outside Victoria or even, outside in the rest of the world, this is something that is really specific, and I'm going to be mentioning things, and I'll probably mention it quite a few times, that's what happens at the Children's Hospital. Let's get the ugly questions out of the way. When will you move your care from the Children's Hospital? And it's usually based around school. Most people come to the clinic and we aim to see kids at the age of 15. Most of the kids come to the clinic and think that, well, the cutoff is 18. Well, that's not really true. We like to see, and I will mention this a few times too, that the NF team have now got the gold standard for transferring their patients. And that's mainly because they're very organised and there's a clear pathway. In fact, there's only one pathway. At the transition team, we see teams or young people with many conditions across the hospital. There are, in adult services, there's various places that other people can go with other conditions. With NF, there's one place, so it makes it very easy, very straightforward. And the where is with Kate Drummond at the Royal Melbourne. Now, this is me. The picture, is it on my left? I'm not sure. In my natural environment at work, I work on the Kelpie ward, which is the adolescent unit, part-time, as well as with the transition team. And on the right is the band that I play in. We're called the Rectal Tubes. If you want to Google us, you can, but be aware, Rectal Tubes Band. Don't go just Rectal Tubes, you might come up with something else. I put that up there because I'm a great believer, and this is something that we talk about in our transition clinics, is that mental health is a big issue in the world, and doing things positively for your mental health is really, really important. And this is how I gain a lot of my enjoyment in life, is playing with these guys. We're not very good. I'm going to stick my hand up and say, but we're improving. We've been playing since 1998, so you would think that we would have improved a lot by now, but maybe not. Actually, I would like to say, before I go on, thank you, Ty, because you're making me look good today. So, transition. Let's go back to a definition. It's the purposeful, planned movement. And so this is what we're talking about when we see kids at aged 15. From adolescents and young adults with a chronic condition from child-centred to adult-orientated health care systems. The transfer is the moving. Okay, definitions out of the way. When we meet young people in the clinic, they might have been seeing Gabby for a very long time, a vast proportion of their life, hopefully. And they are quite concerned about leaving the Children's Hospital. And this was one young person's definition of how they felt just prior to leaving. And I'd like to think that this person hadn't been coming to see us, because we want it to be planned, and we want them to be prepared. So I am a little bit daunted by being in this room today, because there's some very smart people in the room. I am not one of them. I'm the blunt tool in the shed. I'm going to dumb things down for you. So there are 4 things that I want. If you can take away, actually, I will clarify that. I want you to take away one thing today, but these are the aims of the transition service. We want you to be able to talk about your health condition. Number 1. We want you to be managing your medications. Number 2, we want you to be tracking your appointments. Number 3, and the most, and it should have come at number 1 really, we want you to know who to call, how to get in contact with your team if you have an issue. I'll leave it up to Gabby and to Kate to decide when you call. My job is for you to know who to call. So let's go back up to the top. Why do you need to talk about your health condition? And we have a distinguished guest and a graduate from the Children's Hospital here today. I'd like to say hello to Ricky, because he's been through this and maybe he can get some things out of this even now. So why do you need to talk about your health condition? Talk about it at school. There are specific things that we will guide you through and at least mention in the transition clinic. One is special provision for exams. Apply for it, ask about it. And there's also a thing, if you want to go to uni or TAFE, C, Special Entry Access Scheme. I'd really encourage you, I won't go into the specifics of it today, but I'd really encourage you to look at those things because they apply to you. I encourage people just to be honest about their health condition. Talk about it with your friends. Again, going back to that mental health thing, I think sharing things and information with people is really important. Sharing problems that you have, and they might be related to your health condition. Make sure you talk to your friends about it. Work. How do you go applying for a job? Do you need to tell your boss that you have a health condition? Legally, you don't have to offer that information. However, if they ask you a direct question in an interview, then you've just got to be honest about it. We want kids to be able to say what NF is, tell them how it might affect them or not affect them at work. The fact that they're linked in with a health service, they see their health service, not very often hopefully, and they take their medications. That's the basics of it. So then we'll move on to, actually, before I go on, there is one thing when you do mention that you have a health condition. I think that everyone has special personality traits that they can directly relate back to having a health condition. I tell kids all the time that you are probably more mature than other kids, and I don't like to look at the parents when we say that. If you're managing part of your care, you're organised and you're responsible. And I think in spades, you are more resilient. So if you can talk about your health condition a little bit, keep it brief, but then say something positive about it. You know what? I'm way more resilient than my counterpart next to me because of this. Medication management. Knowing what your medications are. That might be obvious, but a lot of kids come to our clinic and say, yeah, I take the blue one and the red one. Really? The first thing in about managing medication, knowing what they are. And I believe in cheating in life. One of the things that I'll talk about a little bit further down the page is the MyRCH portal. If your medications are prescribed by the hospital, they will be on the portal. You've got a list there. You've got the dosages, you've got the name. We also encourage kids to take on administration. This can be a little bit fraught for parents particularly, and it comes with a word of warning. I have a colleague who does have a health condition. She went from the Children's Hospital to an adult service. She's lived this experience, and she hasn't lived with her parents for, say, 12 years now. But whenever they come to her house, the first question they always ask, have you been taking your medications? It never leaves us. It's a way that, as parents, we show love and care for our young people. Don't take it as an offence. It's just something that we have to ask. We encourage kids to set routines, and we encourage parents perhaps allow a little bit of failure. We know that we learn as humans. We learn from our mistakes, hopefully. We also encourage them to go to the pharmacy. Do it once in your life before you move out of home. Make sure that you know the process, know where to get access to your prescriptions if you need them, and yeah, just do it. Appointments. One of the things that we stress is not only putting them on a calendar, using the MyRCH portal or the Health Hub at the Royal Melbourne, but make sure that if you can't turn up, you've got a SAC that day, you tell someone. I'd encourage everyone to, or all the young people that we see, I'd encourage them to make the call. Get through that process at the Children's Hospital, because that's what it's like in an adult service. Kylie and Marcia, who I will talk about as being the key contacts in the both centres, they are good at chasing people down, but they don't like doing it. Okay, so if you can't turn up to your appointment, please tell someone. Gabby has mentioned this before in the previous talk. I'd encourage linkages with GP clinics. GPs become very important. They should be important in young people's lives, but they do become more important as you progress through the health service. A lot of kids that we see at the Children's Hospital rarely go to see their GP. When you're moving to an adult service, I'd really encourage you to develop that relationship. Even if you aim to see them once a year, have an extended consultation. It doesn't have to be because you're unwell. Get to know them. Let them get to know you. There are some things that we encourage kids to do. Most kids have a phone, and I would encourage everyone to make sure that they have it in case of emergency contact on their phone. Apple, if I'm allowed to mention brand names today, they have an inbuilt system. It's in the health app. You search it, it's medical ID. Android phones, you can get one. Samsung have a couple of different ways to do it. I'd really encourage you. But how it works is that if an ambulance is called, they actually don't look at medical alert bracelets or necklaces anymore. They go straight to your phone. Often they're making a phone call from your phone. Parents are more likely to pick up. And I've also got the MyRCH portal there. It is a system at the Children's Hospital. It is replicated at the Royal Melbourne Hospital and it's called the Health Hub. I would really encourage all young people at the Children's Hospital to get access to this, to know how it works. You can get notifications about your upcoming appointments. It has a question, are you coming? Yes, no. Not only that, I've mentioned before about the medications, your prescribed medications are on there. Gabby, who meticulously writes letters. No, he doesn't. He does, but he doesn't use it. Anyway, he can send those to your portal and you get access to that until the age of 25. Your first appointment at the Royal Melbourne Hospital will appear on your MyRCH portal. So you're not going to be lost to follow up. So the transition team, how do we work? We get referrals from Kylie, and that's how we know about the young person. We aim to see the young person initially with their family once a year. And we just go through and it's just a chat. We can do it via telehealth. We like to do it on the same day that you have your NF appointments. That can be a very busy day, or we can see you during the school holidays. It doesn't matter. We're happy to be contacted via email or through Kylie if you want an appointment or if you need an appointment. Yes, so that's how we get our patients. And as I said before, we do see conditions across the hospital. There are other things that you can get involved with. One of the events that Ricky went to was the graduation ceremony, and it's just a nice way of saying goodbye to the hospital. It's held in February every year. The last few have been online, and there was an absolute disaster in the hospital last year because our internet service crashed during the ceremony. I apologise. So there are some differences between RCH and the Royal Melbourne. At the Children's Hospital, if you wanted to bring your grandmother along to your appointment, we would probably more than likely talk to her. We are family focused. In the adult service, we're looking more at individuals. We're looking at patients. There has been interesting times recently about COVID and the restrictions in hospitals, face-to-face visits. It is problematic that they are excluding visitors, excess people from the hospital service. That's unavoidable. It's about keeping people safe. But we've had instances this year where people have been going to the Royal Melbourne Hospital for their first appointment, and parents who have normally gone to every appointment in their life have been told to wait outside. One of the things that we encourage kids to do is when they're moving towards the end of their time at the Children's Hospital, have solo appointments, because that's going to be what happens in the adult service. And as you get older, Gabby will start talking to you more and more rather than to mum and dad. I can't stress that enough, that practice it where you are now, and then later on that whole system becomes much easier. The Children's Hospital, I think was renovated, new building in 2011. I might be wrong. It's a very nice place to work. It's a very nice place to visit. It's very impressive. The Royal Melbourne, maybe not so. I will talk about this later on, that there is, we went during the transfer day, we used to, when it was face-to-face, we would walk down to the Royal Melbourne Hospital and see where the clinic is. I think that was a bit of an eye-opener for young people. It was a little bit confronting. I think on one of the visits, some police were escorting someone into the hospital. Marcia did handle that very well, though. Marcia Fleet, the coordinator of the clinic, she did say, that happens occasionally. Sitting in the clinic itself, in the waiting area, it was very busy, much more busy than the small areas, the waiting areas at the Children's Hospital. So there are going to be some differences in care. A lot of the services, as Gabby pointed out, are linked. They're under the one roof. It is a one-stop shop now that the NF team have put on at the Children's Hospital. That may not be the case in an adult service. And sometimes, believe it or not, the costs change between RCH and an adult service. I'm talking about medications and things like that. I always say when kids go to the pharmacy, make sure you take mum and dad's money. Why are we doing this? We want you to be linked into an adult service. We want you to feel comfortable and confident in going there. We want to avoid poorer health outcomes, lower quality of life, poorer psychosocial outcomes. And if you are not looking after yourself, if you're not being seen in the adult service, then you're likely to need admissions, and that is very costly for everybody. We want you to be linked in with your adult service. So how do we promote this? We aim eventually to see kids on their own. We identify goals. Some of these are not huge. One is making sure you have access to your Medicare card, whether that's taking a photo or downloading the Medicare Express app. These are not enormous things to overcome, but they're things that we think are significant. We ask about your adherence with medications. And we don't judge, but we want to offer a few solutions and help you focus on those things. And we offer positive reinforcement. As I said, one of my colleagues has lived this. She has experienced it. And I think when she sees young people, as opposed to this old person seeing young people, it's a different impression. And she has said, well, this worked for me. And I think that's a really powerful statement to make. What other things might help? There is a program in the hospital called CHIPS, Chronic Illness Peer Support Program, that we encourage, if you would like to get involved with. I won't go into what that's about, but it's a youth mentor role modelling system of things. We talk about transition early. We have a planned independence. And I did mention before some of the systems that can overlap. We'd encourage you to get involved with your GP. These are some parent perspectives, and I would like to point out that they're probably a little old now, and they won't relate to the NF team and the young people with NF, because hopefully they've seen us and they've started at least talking and having the conversation about them. Paediatric clinicians, and it might be interesting to contrast Gabby and his talk and Kate and her talk. I would argue that you're going from a person who is caring, who gets stuff done, to a person who is caring and they know how to get stuff done. But there is this perception where paediatric clinicians do these things, that they're a little bit concerned about what their where their young people are going to go. Do they have their trust? Well, as I said, I think the NF team have the gold standard for transferring their care, and that's because it is planned. They know where they're going. They have a transfer day where they talk through the patients, and then the patients get to meet their adult service. And the most important thing is that Marcia Fleet is the contact person. This is how you contact her, and the guys, Kate and Gabby, will go through when you contact her. And this doesn't relate to Kate because she's so used to getting kids from the Royal Children's Hospital, but I think initially when my boss took over the service, Evelyn Culnane, and please refer any complaints to her, I'll give out her email address later on, she was instrumental in trying to change clinicians' perspectives to say this is what we're doing and this is how we're going to do it. So hopefully none of those things apply anymore. This is a picture of a transfer day and how it works. So the clinicians get together, they have a chat about the patients, then the patients get to meet their adult service. So that's kind of what I've said there, but I have a more specific example. So we aim to see the young people when we get a referral from Kylie around the age of 15. We see the patients once a year. We identify goals and we track those goals over the years and hopefully offer, different ways of doing things. And we need to engage further supports if we need that. Then there is the joint transition meeting, and believe it or not, it's on the morning of the joint transfer meeting. It's about an hour before. One thing that I will say about the clinicians meeting together, every time they ask Kate will ask, Gabby, when do you need this patient to be seen? Soon, middle, late. So you are being triaged. So if you're having an appointment in November of the following year, it's because you can probably wait. However, Kate will always say, if you have a problem, if you think you need to be seen earlier, please contact Marcia Fleet. Oh, go back. Oh, trying. Good, thank you. I told you it'd make me look good. And then after the joint transfer meeting, and back in the day, pre-COVID, we would actually wander down the hospital and we'd have a chat on the way. Maybe the young people might interact, who knows? And then we would go see where the Royal Melbourne outpatient waiting area is. And then after that, you will get your first appointment at the Royal Melbourne Hospital. There are lots of resources, and I will point you to the website, the webpage. You can have a look at those, you can copy those, you can download those, I don't really care. If you would like to contact us, be my guest to get a hold of Evelyn Culnane. She's in Canada at the moment because that's why I can say that. But she will offer those services. If you think you need to contact us earlier for an appointment, that's the way to do it. I have put this in here because we are quite unique. We are a hospital-based transition service. I'm not sure in New South Wales there is a group called Trapeze, but I think they're externally based from the hospital, so no, yes, me neither. But as I said, I am specifically talking about the RCH. But in Finland, they have converted or altered some of our information, and they use that widely throughout the hospital. And the other example there is from Queensland. Please ignore the page on, or is it on my left, I think? But I want you to take note of the My RCH portal. Again, I can't stress highly enough, please try and get that involved. It's no more tricky than getting a Netflix account, apparently, but I know that I dish that off to my young people in my house and they organise it for me. Now, I would like just to stress again, the most important thing that we press upon young people and their families is knowing who to contact. Now, I know I said that there's very smart people in the room, one being Gabby, the other one being Kate, but the most important person for, I think, at the Children's Hospital NF Clinic is Kylie. She will always ring you back. She will always answer her email, and I can't say the same. I know Gabby doesn't do that. At Royal Melbourne Hospital, and I can't talk about Kate, but Marcia Fleet does the same thing. So please, if you need to contact them, make sure you're contacting Marcia Fleet. She will always know where Kate is, no matter where she is in the world. So those 4 things again that I would like to stress. One is knowing a bit about your health condition, managing medications, turning up to your appointments, knowing how to change them, and knowing who to contact. Thank you.
Thank you, Jamie. Have we got any questions in the room or online? In the room, no?
Do I need to go back? Do I need to go back and talk about the rectal tubes and how we've been played on radio?
No, we don't. I've got a question here. I'm from South Australia and there's not much help here. I've had some liberation through CTF, amazing help and information, but can I get help in other states?
You would have to be seen in the NF clinic at the Royal Children's Hospital. I'm not sure if I should advertise this fact, but I did talk to someone from Perth the other day because they were seeing Gabby.
Okay. Any other questions in the room? No? Thank you, Jim.